Hello and welcome to our Friday webinar. Let's see, we're back with Dr. Lamb. Hi, Dr. Lamb, welcome and thank you for joining us. Is this our first one in 2026? I think so.
Hi, good to be back.
Uh, yeah, so wow, we're doing a kind of a heavy a heavy hitting one today, but a necessary one. So if you're just joining us, we're going to be discussing I guess basically saying goodbye at the vet, right? That's our so
Yeah,
okay.
that's our
Um,
topic today.
I'm going to make you a co-host before I forget, because
Okay.
I believe we're doing a PowerPoint, right? I
Yep.
don't think we've ever had. Well, we've had very few without a PowerPoint from you. So
Yeah.
um, let's see. So if you're just joining us, yeah, let us know where you're coming from, where you're joining us from, and any weather updates because weather's all over the place where different people are logging in from. We got people from Arizona next in your neighborhood there.
Yep.
um, there we go. Also, I mean, I know I got these. I got my tissue box. Wait, can you see? It's all handy, ready to go because we got a heavy topic
Oh,
today. So if anyone else needs to go and grab a tissue box, now's the time. No, but and this will be enlightening and yeah. So let's see. How's the weather in Phoenix, real quick, before while
today
we
it's
wait for.
pretty overcast. But it's been oddly a little bit warmer than typical for the time of year. But today is a little cooler than what it was yesterday. So I don't know. The weather's just kind of been all over the place. My desert tortoises, I have two of them that live outside, and they're a little confused. They've been up throughout the week, and normally they're still in their burrows this time of year, but it's been warm enough to keep them up.
Wow, that's right. They hibernate, right?
Yeah.
How long do they hibernate for?
They usually go down sometime between like the end of October, beginning of November, and they usually stay in hibernation until like March or April. It depends
What?
on it depends on the season, like or the year, how warm or cold things are. The cooler it is, the longer they're going to stay in hibernation. Um, but this year, because it's been a little funny and staying warmer than it should, they're up right now. Hopefully
Oh
they
wow.
hopefully they're back in bed today.
Oh my goodness. Okay, that's amazing. Wow, I can't imagine sleeping. Well, I can't imagine myself sleeping that long, but not in a healthy way. That's crazy. Oh my goodness. Okay, learned something new. Okay, so let's see. I guess you should probably move along here and have you take it away. And if we have time
Sure.
for questions, because I think we will have some questions probably at the end.
Okay.
So if you do have a question, please use the Q&A button, not the chat feature, so we can get to it easier. So, all right, Dr. Lamb, here we go. Got my hankies. I got a handy here.
All right.
All
Let me
right,
go ahead and share my screen. Okay. All right. So yeah, this topic I wanted to talk about today because it's something that's a very emotional topic. Um, and it's, I think, hard for the vast majority of people who have to, at some point, say goodbye to their beloved pet. And I know that you guys had done a very similar topic with Lisa Bono previously, but I wanted to do it from the perspective of being a veterinarian because I wanted to show you guys sort of what happens behind the scenes or what you can expect, so that at some point in your life when you are in these situations where you do have to make the decision to say goodbye to a beloved bird, and of course this can be for other pets too, but when you have to say goodbye to your bird companion, you're kind of knowing what's going to happen so that there aren't any I guess things that could be confusing. If when you know what you're up against, it just makes things a little bit easier when you understand what you're dealing with. So we're going to get into it. First off, this is a picture of various pets that I've had to say goodbye to, my birdie friends that I've had to say goodbye to. Um, and it's never easy. I may have lots of birds on this screen here, but I can tell you each and every one's name. Um, And all of them were important to me in different ways. Um, they're all great pets that I really loved sharing time with. Down in the far like left-hand corner, that's me like back in vet school actually, with my hand-tamed zebra finch, and his name was Leonardo da Vinci. I've had him in different pictures throughout the years in our webinars. And he was with me for a little over 7 years. I actually hatched him from, well, I didn't hatch him from eggs. He was a couple days out of an egg, maybe just 1 or 2 days out of an egg. And I hand reared him because his mother had passed away. I had just happened to walk into a pet store to get crickets for my leopard gecko, to feed my leopard gecko, and somebody was there trying to give him to the pet store because the mother was dead and she didn't know what to do. And I said, oh, I know how to hand feed. I can take him. So I took him home, and he just blossomed into this amazing little bird. He was just so great because, you kind of sometimes don't expect the little tiny finches to be hand tamed, but he absolutely loved people. And it was really hard when he passed away, and so I think, for anybody who is going through this, know that, the veterinarian that you're working with, they've been through this too, having to say goodbye to their own pets. Of course, they've been through it with other patients that they've had, but they've been through it with their own pets, and they know that it hurts. They know that it's not something we enjoy having to do, to say goodbye to our friends. And so, knowing that the person who's there with you, helping you say goodbye to your pet, has been through it before, I think can, kind of help, because there's a little bit of camaraderie in that, knowing that that individual has been through this many times too. And all those little animals in our lives that we've met are really important in all their own special ways. So, okay, so what happens when you go to the vet? What can you expect? If you come into the vet and you are pretty sure that this is the time for euthanasia, humanely saying goodbye to your pet, your veterinarian is still going to talk with you first. And they want to talk with you because they just want to make sure everybody's on the same page, that we all know why we're doing this. I will say that unfortunately, sometimes there are convenience euthanasias where people bring in pets to euthanize them because the pet's no longer convenient in their life. And veterinarians really don't like doing that. It is something that I don't know that I've ever met a veterinarian that's like really okay with that. And so sometimes, we just want to make sure it's not something like that. And then also just make sure, like, are there other options? Because sometimes there's pets who come in who look pretty ill, but there might be something we can do. And if so, what are those things that we can do for that pet? Sometimes I've had people come in before, pretty sure that they were going to euthanize, and when I looked at the pet, I said, actually, I don't know if today is necessarily the day. I'm seeing, this particular problem, and there might be something we can do about it. Are you guys interested? Would you want to try to potentially see if we can help this little one? And in most of those situations, I've had owners say, "Oh my gosh, yes, I would like to try to do something," because sometimes, we just see something, our pet is ill, we don't know what's going on, and we all jump to conclusions sometimes, or we think, oh my gosh, this is the worst possible thing could be going on. There's no way we can resolve this. But sometimes that's not actually the case. And I'll say that for myself too. There's been plenty of times where my animals have been sick, and the first thing my mind goes to is like the worst possible diagnosis ever. And then, I have to reel myself back in and go, okay, well, hold on a second. What else could be going on? Is there something we could potentially do here? Is it the right time? That's something that your vet is probably going to talk with you about. Sometimes you come to the vet and you don't expect to even be talking about euthanasia on that visit, because maybe something's going on that you didn't realize how bad it actually was. And so if your veterinarian's looking at your pet and finds that something is pretty severe with your pet, and it may not have a very good prognosis, and you weren't expecting that, your veterinarian is going to talk with you about that and say, well, is it the right time for us to do this today? Because maybe there's still some stuff that we can do to get a patient more comfortable, a pet more, some supportive care, give owners time to kind of let the thought of what's ahead of us about to sink in. But of course, if the decision is made that yes, now is the right time, humane euthanasia is the most appropriate thing for us to do for this individual, then your veterinarian at that point is just going to talk with you about what to expect the next, 10 to 30 minutes is going to be like. So we're gonna go into that here in a bit of detail because sometimes maybe your vet doesn't go into a lot of detail. Sometimes they go into more surface sort of things. So we're going to get into a bit more detail today. So the first thing I wanted to talk about is the medications that we use. When we are choosing to put a pet to sleep, we do usually utilize some medications to help them along. And oftentimes we are first doing some sort of sedation for the pet. The sedatives are variable based on what we are using. We often are using some sort of opiate. Opiates help to relieve pain and they help to sedate patients. In particular, when it comes to birds, we're often using a medication called butorphanol. It's just a particular type of opiate that tends to work well for a lot of our parrots. So it's going to help them with any pain they may have. It's also going to get them sleepy, which is what we want. We want them getting sleepy and relaxed. We may also use some sort of anxiolytic. What does that word mean? That means that it's going to sort of block any anxiety that an individual has. It's going to help get them calmer. And the medications your vet may use for that purpose is going to be things like midazolam or diazepam. They're both in the same class of drugs. Diazepam's kind of the older one, not ineffective, just an older one that's been around longer. Midazolam's on the newer side. Both are appropriate. It may vary based on what your veterinarian has available to them, but you might hear those medications being used in the sedation process. Other things that relieve pain and sedation may also be used. It really depends on the individual, how sleepy they're going to get as to whether or not they need additional things from an opiate and an anxiolytic. Some patients are in a lot of pain and they need multimodal pain therapy. And so we may use something like ketamine. We may also, I didn't have it up here, but we may use something like meloxicam, which helps reduce pain. If we have a patient who is a little bit more anxious, I may want them to be pretty much like almost completely anesthetized. And that's where I'm going to use something like Alfaxan, which is something that we use regularly for a sedation procedure in the event that we're going to be putting them under anesthesia and doing some sort of procedure with them. So all these medications that are actually on here are things that we use on a quite normal basis. We don't use them just for sedation for euthanasia. These are actually medications that we use prior to going into any surgeries. And again, they kind of work in different ways with the goal of sedation and pain relief. Now, the medications that are actually used for euthanasia itself, there's not a lot of variety there. The big one and the most common one that you are going to see a veterinarian use is pentobarbital, is the actual drug name. But the typical name that we call it, because it's kind of like the brand name, is Euthazol. It actually was an older anesthetic when people were figuring out different anesthetics to use. This is one that is in the class of anesthetics that we don't really use it anymore for anything other than euthanasia, but it did previously, a long time ago, be something that could be used as an anesthetic. But because we've gotten better with anesthesia over time and drugs and things evolve and change as we understand how they work better and understand how we can do anesthesia more safely. Certain things fall out of favor, and so we don't really use that for anesthesia anymore. But it is actually quite helpful for euthanasia. Important things just to be aware of with this medication is it's pretty thick material. So it's kind of hard for the veterinarian to like push it through a syringe. It's not something that gets quickly passed through a syringe. It's very thick, so it kind of slowly gets injected because of the viscosity of it. It's also usually something that it's a large volume that's used. So don't be afraid if you see your veterinarian coming in with a syringe that looks like it's large. It's just because it's a large dose that's actually utilized. And then the other thing that you may see used to some degree, and I don't know how it will change with time, but you can actually use potassium for euthanasia. I do know some veterinarians like to use that. The benefit of potassium is it's actually less toxic. It's just potassium. You know, potassium is a natural element that's in our bodies. So it's just that it is something that when you have a lot of potassium, it actually can interfere with electrical activity in the heart and stop a heart from beating. So while it is a natural thing that's in our bodies, it's in our diets, you know, we need it for life. It's involved with normal nerve signaling in our cells. It is something that when we use it as a very large amount, it can facilitate euthanasia. So it may be something that people use more later on in the future because of the fact that it is a less environmentally wasteful thing. The only thing with this is the patient really needs to be fully anesthetized in order to humanely use potassium. It has, because it's a natural element that's in the body, because it's involved in electrical signaling, can be a little bit excitatory. And so they really have to be fully anesthetized if this is actually going to be used. So just being aware about the different kinds of euthanasia solutions that are out there is, I think, good for people to know about, but know that the pentobarbital or euthanol is actually really the most common one that's actually utilized for the actual procedure. Okay, so as far as the timeline of events of what actually happens when you go in to take your pet to be put to sleep, we usually start off with sedation. We have the actual euthanasia itself. There's still stuff that happens after they pass. And then I'm also just going to briefly touch on charging. So we'll get into all of those things. So the sedation that we just talked about, all those different types of drugs that we use for sedation, it usually takes about 5 to 10 minutes for a patient to get sedate. This is a picture of Arroyo. He was getting sedated in order to have a nail trim because I like to sedate Arroyo for nail trims because the midazolam medication actually, not only is it an anxiolytic, it actually also has some amnesia properties. It is kind of variable how much amnesia they actually get, but it has the ability to make a patient potentially forget anything that they don't like. And Arroyo really hates to have his nails trimmed, despite the fact that I have, tried to make it as low stress as possible for him. Of all my birds, he is the one who is the most dramatic. So I usually sedate him for his just simple nail trimming and that sort of stuff. So he is just getting sedate in this picture. This is what a bird looks like when it starts to get sedate. So you can see that he's quite sleepy in the cage here. His eyes are closed. He's a little ruffled with his feathers. His wings are a little bit droopy. This is what you should expect your bird to look like when it is getting sedated in preparation for euthanasia. Now, of course, Arroyo was not euthanized. He's at home. He's fine. He's totally normal. It was just a good picture of what a sedate bird looks like. I just wanted people to see, because if you haven't seen your bird get sedate before, it can't, which most people are not seeing their bird get sedate, right? Because usually when a bird is sedated for any sort of grooming event or procedure, surgery, that sort of thing. It's all happening in the back. People aren't watching that sort of stuff. So, this is what a sedate bird looks like. It's okay. They're just sleepy. Now, if a bird is feeling really sick, whatever its underlying illness is that's causing us to go forward with humane euthanasia, they may be quicker than that 5 to 10 minutes to sedate. There's been some patients where I've given the injection to them in the room with the owner for just sedation, handed the patient to the owner, and the bird's already started to fall asleep as I hand it over. And that's when that happens, that lets us know that, yeah, we're probably, this really is the most appropriate decision, because if you're getting sedate so quickly with the typical drugs that we're using, you're probably quite a bit more ill than what you're letting on to. And we all know that birds are really good at hiding signs of illness. And so, when they no longer have their guard up because now they're getting sedated, if they sedate really quickly, then, it lets us know that we're making the right decision, I think. And in all honesty, if the patient is really sick, sometimes the sedation is enough that they can pass away from it. It is okay if that happens. I know I've had owners sometimes be concerned, like, well, if that does happen, like, was that supposed to happen? Why didn't we get the second shot? Well, if the pet dies from sedation alone, they're pretty ill. And again, it's probably that we're making really the correct decision if they couldn't even handle sedation, staying alive with sedation, I should say. So, and again, what is the sedation? It's just things that make them relax. It's things that deal with any pain. So it's really still euthanasia. With euthanasia, the word actually means good death. So, if you're relaxed and you don't have any pain, I think that's, everybody is going to pass at some point. And if you're going to pass without pain and you're going to be relaxed, that seems like a okay way to go. So, now most patients, they're going to get sedate with the medications. Your vet is typically going to leave the room while the pet is getting sedated. And after 5 to 10 minutes, come back and check in and see how the pet's doing. And if at that point the pet's nice and sleepy and you as the owner are ready, then that's when we will give the euthanasia solution. Again, as I had mentioned, the euthanasia solution, it is very thick. And so it does not, when we're pushing it through a needle, it doesn't push through rapidly. So know that the vet is injecting it what seems like slowly, not because they're purposely trying to prolong anything or, make them be around longer or anything like that. It's just because it's literally just a very thick substance moving through the syringe. And that being said, is that sometimes by the time the injection is done, it's such a quick thing that many times the patient is actually passed by the end of the injection being given. Now, if the patient has poor circulation for some reason, then it might take a little bit more time. But the vast majority of birds, because they have such rapid heartbeats and circulate blood throughout their system very quickly, the vast majority of them, by the time the injection is done, they have passed. It's important to know that they can have something called agonal breathing or agonal movements. This is where in our cells, in our body, so our little individual cells within our body, there is energy that's kind of stored within those cells and everything in the muscles. And after the body has died, that energy and like everything sort of shuts down. That energy that has been stored kind of is like released, and it might stimulate some muscle contractions. when it stimulates muscle contractions associated with respiration, you can see a patient take a breath. It may seem like they are gasping, but don't worry when you see that. The pet has already passed. That's the body just releasing that energy. So that gasp that they do is they're not even around when that happens. That is a simply a muscle contraction that's occurring. They may also even do some little like twitching movements of their feet, or even like a whole like movement of their like wings or legs. And I would say, interestingly, I've had many birds where when they pass with the euthanasia solution, they actually kind of put their head back, put their wings out, and do like a little fluttering, like I've described it before as fluttering into the light. Um, and it's just something that birds do. Again, it's the muscles energy that's stored that's just getting released. It's causing those muscular contractions. So it can look a little weird when those sort of things happen. And it can be alarming for people who have never seen it before, because if they see gasping, oh my gosh, are they suffering? If they see little twitching movements, oh my gosh, are they trying to like run away? Or if it's, our birds who do this sometimes, little head tilting back and flapping their wings up, like, are they trying to fly away? Are they trying to get away? Are they distressed? No, they're not distressed. Everything's okay. This is a normal process of those muscles having contractions because of energy stored. So totally 100% normal if you see this sort of thing. It doesn't happen in every single case. I always try to tell owners about this possibly happening before we actually give the euthanasia solution. In all honesty, I'm sure there's times where I have failed to tell owners that. And so I want to tell you guys, because if you are in this situation and your veterinarian forgets to tell you this sort of thing, it's okay if it happens. Okay, so sort of the next thing in our timeline of events, what happens after they have passed? Well, at this point, you can be with them for as long as you want. You can be with them for as short as you want to. This stage after the pet has passed away is different for everybody. And nobody should feel bad with whatever decision they make. If they want to sit with the pet for a while, totally fine. I've had some owners sit with their pet for maybe up to an hour after they've passed away. And that's okay. We all grieve differently. And for some people, they need to sit with them for longer to, feel more comfort. Other individuals don't really like to be around when the pet has passed. And that's totally fine too. I've had some owners say to me before, like, I don't really want to be around. I feel bad. Is that wrong of me? No, it's not wrong of you. It's just your own personal thing. If you don't really like to be around a deceased pet, that's completely fine. It's really about your comfort at this point. And everybody is really different in how they handle this point. And whatever you decide, like, it's totally fine. Everybody does it differently. And don't let anybody make you feel bad. Like, I've had some people before say, like, oh my gosh, I can't believe they didn't want to be with their pet when they passed away. Nope. Don't feel bad about that. We all manage and deal with death differently. And this is a good point for me to say as well. Some people don't even want to be around for the final injection. And that's completely fine. I've had many owners who have said, I'll be there for the sedation. I'll be with them as they fall asleep. But once they're asleep, can you please take them in the back and do the actual euthanasia injection in the back? Of course, can absolutely do that. That's not a problem at all. And I've had other owners who haven't even wanted to be there for the sedation because they want to remember their pet as a lively individual. They don't want to remember their pet as getting sleepy. And, I don't know that everybody does remember that afterwards when they have been there for a euthanasia. But it is something that I have had some owners be worried about, that they'll remember them differently. I will say the first time that my husband had to be around for euthanizing a pet, prior to that, he was really worried about being around. He didn't want to see it. He didn't want to be around a pet that had passed away. He wanted to be completely out of the room. And for better or for worse, I did encourage him to stay and be around for the actual euthanasia station, the euthanasia, all of it. And he sat through it and everything. And at the end, he said, that actually wasn't so bad. And at this point now, he's able to be around it, whereas before he was just so worried about it. I've had owners who were worried for their kids being present for euthanasias. And of course, parents need to make that decision for their kids. It's not something for me to make a decision on. I will do whatever an owner wants me to do. But I will say that I've had some circumstances where the parents of the children didn't want to be in the euthanasia, but the kids really wanted to be in the euthanasia. And it was decided that the parents would step out and the kids would stay in, and the kids did great. And the kids even said, to the parents, it was okay. It wasn't bad. We're happy we were there in the end. And so, I think that there can be a lot of fears that we have associated with this. And, you just need to know yourself and know what you may be able to handle. And it may change from one pet to the other. Whereas one pet, you may be able to go through the euthanasia event from start to finish, another you may not. And again, totally fine. I had a euthanasia yesterday that I had to do on a bird that had never been sick. It was totally fine, that the owners knew about, and had about a 24-hour history of being lethargic, sitting on the bottom of the cage, fluffed up, regurgitating fluids, not eating anything. It came in, I looked at him, I told the owners what I was really worried about with this patient based on what I could find on my physical exam. Ultimately, we decided with this individual, with how bad things were, humane euthanasia would be most appropriate. And the owners had said, okay, we were worried that and suspected that this would be the case. But they had said to me, when I asked them, I went through all this stuff of here's what's going to happen with the sedation and everything. And you can be here or not, whatever you want to do. They said to me, nope, we don't want to be here for any of it. We want to say goodbye right now in the room. We want you to take her in the back and do everything in the back without us, because they recently had lost a couple of other pets. And so this was the third pet they'd lost in a short period of time. And it was just, they said to me, we've been around too much death lately. And so to hear that, for their other pets, they were able to be there. But for the individual yesterday, they didn't want to because it was just too much. They were just around too much lately. And that's totally fine. Like, life isn't always fair. Sometimes we do have a lot of bad things happen really close to one another. And, it may affect us differently when we've been through a lot of things versus when we haven't been through, when things are more isolated. So, again, you may change what you do from one individual to another. And I just want everybody to know that that's completely fine and appropriate. I just want to touch on this just super briefly. I don't feel like I ever really talked with you guys about charges of things. Of course, we know that finances are involved when it comes to coming to the vet and doing procedures and doing diagnostics and getting medications and all that sort of stuff. So we all know that happens, but we just don't really talk about it too much because it's really not our primary focus. But I just wanted to say here, this is the point where it can be a little touchy, I think, for people, absolutely, because it's hard to put a pet to sleep and then have to go and pay. Sometimes that can be a little hard. And so it's something that, if you think that might be hard, and a lot of hospitals will charge people out before anything happens, just so that you can leave the hospital and don't have to stop up at the front desk, that way, if you're crying, you don't have to be crying up front, you can feel comfortable leaving. And some hospitals, some practices may allow billing. It's just something to be mindful of, because if you get things kind of done beforehand, you don't have to worry. And the end is really all about your pet and not about things that you don't really want to think about. So I just wanted to mention that it's always kind of better to do it before handle charges before this procedure's done. Okay, so now the next thing is, what do we do with them afterwards? How you're going to go about caring for your pet's body when they're gone is variable, again, from one individual to the next. There's a few typical things that you can do. One option is cremation. And when you do cremation, you can either choose to get ashes back or not get ashes back. When you have a pet that gets cremated by itself, when you have a pet that gets cremated and you want ashes returned, it is going to get cremated by itself. There are even some crematoriums, because it is something that people absolutely have asked before, like, well, how do I know that that the ashes I'm getting back are my pet and not somebody else's? I know several crematoriums that just go, you can come and actually physically watch the cremation service if you want to, the pet going into the area for cremation. Know that whatever you send with the pet will get cremated with the pet. And I say that because I got cremated remains from one of my pets one time, and I looked at them because I just was interested what the cremated remains looked like, and there was a weird little wire in the bag of cremated remains, and I was like, what is this weird little wire? I was totally confused, so I actually called the crematoria service and was like, I'm really confused. Why is there this little wire in here? And they said, oh, that's the little wire that was attached to the tag that was attached to the bag that your pet was in. And I was like, oh, I thought you guys took that out. They said, no, we cremate everything because we don't know what owners want and don't want. And so if you want your pet to go with a special blanket or toy or a treat, you can actually send them with all that stuff in the same bag, and the whole thing gets cremated together. So some people like that. Some people, it may be more comfortable for you to send them with some toy that they really loved, So that is something you can do, but recognize if that toy has any sort of little metal pieces that may not melt very well, you will see that in the cremated remains. So just something to be aware of. Now, should you decide that you want to have your pet cremated, but you do not want the ashes back, in most situations, those pets will get cremated with another pet or a few other pets. That's just the nature of a crematorium working with multiple pets, that they are not giving ashes back to owners. So you just have to be aware, when you make a decision of, am I getting my pet's ashes back or not? That's kind of a final decision, because you can't, if you say, I don't want my pet's ashes back, and then you make a decision to get their ashes back later, it's not going to happen. So that's just something you need to think about. You may also be able to take them home for private burial. Plenty of people take their pets home for private burial. Now, city ordinances based on where you live may vary to where you may not be able to bury pets, maybe not able to bury large pets, but you can bury a small bird, so it's just something that you have to look into your own city ordinances to see if it is okay for you to do that. Again, the good thing is with birds, a lot of them are small, so we have a little bit more leeway there sometimes than some other animals. So there is a newer procedure as well. It's called aquamation, and it's like cremation, but it actually uses water and pressure to break down the body. And so it's a little bit more environmentally friendly because it's not burning. So that's something that you may hear more and more about, or may become more and more of an option for people as time goes on. This little urn here is actually from one of my own birds that I just thought it was a really cute urn, and these ashes are in there. Okay. And then after the actual euthanasia and the aftercare and everything, we're still here, right? And so there's a bit of personal healing that often has to go along with this as well. Our pets mean a lot to us, and it's, I think, important for people to know that it's okay to be upset and miss them when they're gone. I've had a lot of people who feel, or at least express, that they feel some level of embarrassment or something, they shouldn't be upset about their pet dying. I've had people say goodbye in the room, cry, and then say they're sorry to me for crying. And I'm like, please don't like feel bad at all. Like, this is your pet. You're okay to be upset about it. I cry over my pets. I cry over your guys' pets too, but I just don't let you see me do that. Um, like it's okay. Like it's okay to be upset. It's okay to miss them. And how long that's going to take is really variable of from one individual to another of how long you're going to be upset about them being gone for. And for some individuals, I don't know that you'll ever really get over it, but you get more to the point of being okay with it. Now, I'm going to show a couple of resources. So I'm going to stay on these slides for just a few minutes as I talk through things so that people can like write stuff down if they want, or take screenshots, that sort of thing, pictures with your phone. There are different universities out there that have pet loss grief support lines available. And so a couple of the big ones, there's Cornell University, Tufts University. Their phone numbers are there. You can see also websites that are available too, where you can kind of reach out. You're usually like your bigger facilities, like your universities, may have somebody actually there, a social worker there that you could potentially talk with if you need to. Your smaller hospitals, privately owned, you're going to have less of that just because it's a little harder for a smaller hospital to support like a social worker and that thing. But that doesn't mean that those hospitals don't have some resources available for you. Um, and depending upon where you live, your local humane society or animal care and control may have some resources available for you. I'm going to blow these up for you right here. Now, I live in Arizona, so the county in which I am is Maricopa. And so I went to, Maricopa's animal care and control, and they have free pet loss support stuff. So you can see stuff that's local where you live, but then also, again, stuff in different parts of the country, different support groups that you can get to talk with people directly or become a part of an online group. And so I'm showing you Arizona stuff because that's where I live, but wherever you may live, your animal care and control part of the county that you're in may have something like this for you as well. That is an easy resource that has different stuff than what I have here. Again, some of it is more USA wide, I guess. I don't have anything international on here. So for any of our international viewers, I guess sort of same sort of thing, wherever you live, you may be able to find some support groups. But even if you're international, I mean, here we are in this day and age of just being such the world is so connected. I mean, any of these support groups you could probably get onto internationally as well. And then of course, not everybody wants to maybe call a support group or anything like that. It's totally individual, with what you want to do. But remember that there's also individual counselors out there. Absolutely, you can reach out to, independent individual counselors and talk with them about pet loss. That's what they're there for. That's what their jobs are, is to help us navigate through these sort of situations. Your friends who are pet lovers, your family who are pet lovers. Sometimes it can be a double-edged sword of friends and family because, they know you very personally. And some may be wonderful resources for you, and some may not be as into pets as you are and may be like, I don't understand. So, of course, reach out to people who you really know would support you and understand how you're feeling at this time, and other community support as well. I mean, we've got our own little community here, right, where we can all sort of understand how it can feel to go through these sort of things. And then you can do things to help you sort of remember them, right? Things that make you be able to look back on them and get to the point of, again, never, I don't want to say you never get over a pet loss, but help you get to a point where you're comfortable with it. And so this is my little finch. This is Leonardo da Vinci, who I was telling you guys about at the beginning of this talk. And he passed away at a little over 7 years. I think it was like 7 years and 4 months or something like that. And I still remember the day that he passed away. I remember exactly what happened. It was in my hands. And it really was hard. And I could probably like for the longest time after he passed, I would think about him and I would just cry. And I could probably even cry right now about it. And yet he passed away in 2014 and here it is 2026, right? So it's 12 years later and I'm still talking about my finch, who is just the best finch in the entire world. But after a period of time, it transitioned from something of, I'm so sad about this to, I'm so happy that I had him. Like he was such an amazing bird and he so shaped my career. He shaped my life in so many ways. And so there's lots of stuff that I did to kind of remember him. I got him that cute little urn that I showed you, and you can see in this picture it's just flipped around because it has cute birds all over it. I made a little photo album of a ton of pictures that I had of him that I can go back and look at any time. And I got a really nice card from a friend that's inside that photo album that I saved. My mom got me that cute little zebra finch, it's a hand carved little wooden figurine. And then as goofy as it is, I have a little fake uh, casket there, and that actually came off of a cake. I think it came from like a over the hill sort of birthday party thing. And I had saved it because it was just a goofy little thing, and I actually got it before he passed away. Again, it was from like a cake or something, and I was like, "Oh, when Leonardo passes away, I'm going to put him inside of this little casket." And I meant it as a joke, but I still had it, and so I ended up putting some of his feathers in there because I got him cremated and he's in the urn. But I put some of his feathers in there, and it was a silly thing that I did, but it made me feel better, because it made me just think about like, I don't know, he's a tiny little guy. There's other things you can do too. I mean, so I'm going to show you a couple things from some of my other pets. So this is from my dogs. This urn that's in the center is a very big urn. It's from one of my dogs that passed away. If it's a dog, it's way more cremated remains that you get back than if it's a little bird. But these two little necklaces, and in fact, I'm actually wearing one today. I didn't even mean to wear it for this webinar, but then I saw that I was wearing it and I was like, oh, perfect. But they're little like tiny urns that you can put some ashes into. And so it's for like these are both for my dogs. I've seen some for birds. Well, the ones I've seen for birds, I think actually are probably meant for humans because they're like little doves, but that's okay. One of the techs that works here, she has one that is a like little tree sort of thing, and it has the urn right in the center, and it's a cute little necklace. And so it's just kind of a way to have your pets still be with you. Nobody has to know that your pet, I mean, you guys now know that there's my pet on my neck, but it's just a way to have them still with you and still sort of help you to remember them. Here's a couple of other things from some of my birds. Like the earrings there are from my Nande conure who passed away. And when she passed away, she went out for cremation in the hospital where I was working at the time. And I didn't know it, but after the fact, one of the nurses gave me these feathers. What she had done, the nurse had clipped a couple of feathers from her before she went out for cremation, and she made me these nice little earrings. And it was such a nice gift, and totally unexpected. And it is just a wonderful way for me to remember. Her name was Rory. I can remember her and be fashionable at the same time. And then the other things, those are actually like little, they're rings that have, it's resin and a feather has been put inside of it. They're kind of hard to see. It didn't come out as well as I would have liked it to, but that's okay. To me, they're important, and so that's fine. And then other things that I've done. So your vet oftentimes will ask if you want like a paw print, and some vets will do paw prints in clay. Some will do them in ink. You can request. Sometimes I've had some owners who like don't like the clay ones, but want the ink ones, and we'll do ink instead. So just, whatever you like. But it's just, again, also a nice way to kind of remember them. There's their little feet. I have a little outdoor area where I keep some of my cremated remains. Like I've buried the cremated remains in the ground, and I put their little paw prints. So this one's been outside for a while at this point. This is one of my canaries, and so it's a little weather worn. So I guess, if you're worried about things getting weather worn, maybe don't leave them outside. But I was okay with it. And I have them. This one is actually from one of my leopard geckos. And again, they're this little turtle. Actually, I have a lot of cremated pets underneath this turtle. And it's just a nice little outdoor area for me to, go and visit them who have passed on. And I've only done this once, but I'm going to talk about it because some people, it may be a way that they want to remember their pet. I did have one of the vets that I work with. She has beetles that will strip tissues off of bones, and you can actually then have bones to like articulate a skeleton. And she'll make really nice articulated skeletons as a way to remember an animal, or just for anatomical purposes, for us veterinarians who need to know anatomy well. And so I did actually have her do that with one of my finches. And so this is his little skull. I know it seems a little weird, because like there's my finch's skull. His name is Isaac. And so I've only had it done with one pet. And I'm okay with it, like it was fine. I don't know that I'd be able to do that with every pet of mine, but it was okay with him. And I only did the skull. I didn't end up doing the rest of the whole articulated body. But there are people who have asked me, like, what about taxidermy? And I've never personally done that. I've actually never known anybody who's actually gone through with the taxidermy, but there are taxidermists who I don't do that sort of thing. And if that's helpful for you, then that's helpful for you. So the point is that there's many things that we can do after our pet has passed to help us feel like more comfortable, and remember them in different ways. I was going to show one other thing, but I lost the little card. There's an individual who had actually given us some cards, that what she does is she will take feathers from your bird after they've passed, and she'll put them displayed. And the little card that she has is really cute. I wish I could have found it. But it shows like the bird's feathers, like its flight feathers and its tail, like, and they're displayed in such a way as if though the bird is flying, and then she's put like nice little flowers in that she's pressed and put around it and put it into like a photo box sort of thing. So just another like nice artistic way to remember them. And I've thought to myself, maybe one day that's something I'll do with one of my other birds at some point. Who knows? So that is all that I have for you guys. So does anybody have any questions?
Oh, thank you for walking us through that. I think that gives a lot of people some comfort for this process. And yeah, I had a question actually, real quick. Do people ever request? I know some birds still have like leg bands when
Yeah.
as a keepsake. Is that something that you would just see if that's a possibility beforehand?
Yeah. After they've passed, it's fine. That those absolutely can come up. I've had a couple owners ask for that before. So yes, that is something. The only thing is the leg band. Like for me to take it off, I'm gonna have to cut it.
Okay.
Um, if you wait until after they've been cremated, then you might be able to find it actually in the bag of ashes.
Okay. Okay.
Yeah, as an intact band at that point, because
Yeah.
otherwise we'd have to like take the leg off, which I can do after a pet has passed away, but I sometimes that can feel a little hard for owners to
Yeah.
have me do,
Right.
so.
Okay. We did have a question. If all vets know how to euthanize a bird, so is that something that most vets?
Yes, really, it is something that as a veterinarian, we should be able to do it with pretty much any animal that comes our way. Where there might be some difficulties is just knowing the doses of the medications that would be the one thing that, like, let's say I had to put a horse to sleep. I've never put a horse to sleep. I would have to look up the doses of medications before I did that.
Okay.
Um, so yeah, if you're in some situation where maybe you have the, emergency situation and the vet you're working with hasn't really worked with birds, they will have to probably look that the doses up, but otherwise the process is the same between different species.
Okay. So we have a question. A 28-year-old cockatiel held together with a wing and a prayer. So
Cool.
has far outlived his shelf life, and they thank the gods for Avian Vet. So I think we all need to thank you guys for. So they're they know that decision's coming up, and they don't want him to suffer. And will the vet let us know when it's time? Like, do you guys have a pretty good sense of?
I think yes, but also we are very much dependent upon what owners are telling us to. And so, because in an exam room, I may only have, the 30-minute slot to assess the patient. And sometimes there's some things that I may see that I go, hey, oh, this doesn't look too bad. But then when I listen to what the owner has said of what's going on at home, I go, oh, okay, this is actually a little bit worse than what I am visualizing here. Because again, birds are great at hiding signs of illness. They like to act like everything's okay. And so they may do that to some level when they're in the hospital because they're just trying to act better. And so um, it's a combination of what am I seeing plus what are the owners telling me to help guide the owners of is this the right time?
Okay. And someone asked, what should you do when a pet bird dies suddenly at home? Um,
Yeah. So if you have a pet bird that dies suddenly at home, you can call your veterinarian and you can talk with them about those options of cremation, getting the ashes back or not. You don't even necessarily have to go to the vet for that. You can go to just a private crematorium as well, private pet crematorium. You can take your pet there for cremation on your own without going to the vet. And then again, you can bury them. Now, if you have other birds at home, I think this is variable from one individual animal to the next, but I do think that there is some benefit of if you have like two individuals who are good friends, that they see that the other has passed away. Maybe I'm anthropomorphizing a little bit, but I think that may help them understand, like, when we see something that has passed, we know that it's gone. And I think they understand that as well, and that might just be able to better help them socially to get through
Process.
it because if you have two bonded individuals, I mean, they're having to process the one who passes, the one who lives up to the one who's passed has to process that and deal with that loss. So I think it's important that they see that as opposed to just like the bird has disappeared. They don't know what happened. Why am I all
Yeah,
alone?
that's like when the crows do that, don't they? Do that at the crow funeral? They circle and ravens
Yeah.
when they have a fallen flock member.
Yeah.
Um, and so what's the difference between an autopsy and a necropsy? Someone asked,
Oh,
and when should you, if you have more than one bird and one, let's say, passed suddenly, is that something that they should consider?
yeah. So an autopsy means auto means self. So autopsy, the word is specific to humans. Necropsy is for everybody else. So they're really the exact same thing. It just is an autopsy is for people, a necropsy is for everyone else that is not a human. And yeah, if you have multiple birds at home, I highly encourage necropsies be done. I do them with almost all of my birds because I have so many birds, unless I know exactly why they passed or I put them to sleep, then I maybe won't. And even in those cases, sometimes I will still do the necropsies because there's a lot to learn from them.
Okay, and finally, so is there like a quality of life grading chart that owners can access for their bird to kind of assess, get a sense of it?
Yeah, I know that there's quality of life charts for like other companion animals, dogs and cats. I don't know if one has been specifically adapted to the bird, but I still think the way that the dog and cat ones, at least that I've seen, are still appropriate for birds. And the main things that they're usually looking at is like they're asking these assessments are usually asking like, are they eating? Do you have to assist feed them? Do they want to eat? Do they play with their toys? Do they still sleep okay? Like, do they have difficulty getting around? Do they have any sores on them that are coming about because they're having difficulty getting around? So I think a lot of those ones, even though they may be for dogs and cats, could still be applied to birds too.
Okay. Oh, and I just want, so we met, you covered earlier, some of the options, gashes or burial. Just if you're, I know back when if you're like, say, in a renting situation or something, a large planter, have you ever, like a large,
Oh
like
yeah,
tree planter, that's what we do with the viper. So you can always go with this, like like just a really large
yeah.
planter with a tree that was beautiful. So that was one option I thought could work.
That's a great idea too, because then you look at the tree and you're like, my bird's in the tree now, right? Because he's nourishing this tree.
Yeah, yeah, and I could take them with me wherever, wherever yeah, that
Yeah,
was just wow. Okay, just want. I mean, this was a topic that I think it was so nice the way that you covered this. A lot of important information, but you also obviously care about your birds and each of your clients' birds, and I know this is probably part of your day to day that's a little more difficult, but it's so important, and you give people closure and happiness. So yeah.
yeah, yeah.
So so yeah, thank you. And also, yeah, if anyone is joining us today, if you have anyone who's lost a pet, just maybe send them a link to this too, and or if their pet is kind of nearing Rainbow Bridge, kind of give
Yeah.
them this useful information. All right. Wow. Well, thank you, Dr. Lamb. Um, and we'll be back next Friday with Dr. Tolley for Ask the Vet, and that'll be I'll just say like our usual time because I know that you're in a different time. You hop
Yes.
ahead in time for us during the the fall back. You don't fall back, but we do. So,
Right.
uh, all right. Thanks again, and also taking the time from your busy day. I know you have a lot going on during your day. You don't even know what you're walking into some days. So
Right.
thank you for
Exactly.
yeah, thank you for this presentation. Of course, it'll be online. So there are some slides that you showed that could be very helpful for people. So I encourage you to use them as a resource, as well. Like all the Lafeber webinars are on the YouTube channel. So, all right, Dr. Lamb, thanks again, and
Yep.
we'll see you
Welcome.
next time. I want to
All
wish
right.
everybody a wonderful weekend. All the best to you and your pets. And it's Valentine's Day, so do something special for your bird. So,
Yep.
all right. All right, guys. Till next time. Take care. Bye.
Bye.